Hi everyone and welcome back to Audrey Path. I'm Audrey and today we're learning about a really important job in healthcare that helps people in very caring and supportive way. Today's guest is Abeer, who works as a fertility clinic manager. That means she helps run a clinic where doctors and staff support people on their journey to grow their family. She makes sure everything is organized so patients get the best care possible. Welcome, Abeer.
Hello.
I have a few questions for you.
Okay, please ask away.
Okay. Question 1. Can you tell us what you do on a normal day at the clinic?
Of course I can. Well, I actually wear many hats in my role as a clinic manager. I have to make sure that my staff is well supported and the daily operations of my clinic are all running very smoothly. I have to make sure that the patients are being well cared for and everything is being done in accordance with health regulations. I have to make sure that the business is running properly, so I connect with other clinics, other healthcare providers, other labs, vendors, pharmaceutical companies to make sure that everything in the clinic is well prepared for every single day of operation. I assist my staff. I help make sure that the schedule for both the doctors and the patients is running smoothly, so that requires running a very accurate calendar, booking appointments very accurately, making sure that there is an overall good clinic flow. So I do, like I said, I wear many hats in my role, and part of my job is to make sure that all aspects of the clinic is running smoothly with one another.
Okay. Question 2. Did you have to go to college or do any special training to become a clinic manager? What did you have to learn?
I actually do have a university degree in healthcare. I graduated with a psychology degree, and then I did have to also do special training once I joined the first clinic that I worked at. I had to do some shadowing. I had to learn about the different departments inside of a fertility clinic. I had to learn about what a daily operation is like in a fertility clinic. After I was done my training, I did some practice, and then I became the supervisor, and then I became the clinic manager. So it's a little bit of both. I had to get proper education that supports me in such a role, and I also had to do hands-on training and shadowing with someone who already had such an experience in such a workplace.
I have a follow-up question.
Sure.
What does fertility mean?
Well, we help people start their families. So sometimes having a baby happens very quickly and very naturally, and sometimes it takes a little bit longer to happen, and sometimes there may be some health conditions that makes it a little hard for that to happen naturally. So our job is to offer the treatment that some of these conditions may need to help parents make their dream come true of having a baby.
Question 3. Do you mostly make plans and organize things, or do you also help with hands-on work at the clinic?
I do mostly plan and organize things. I need to make sure that everything is running smoothly in the background. That way the daily operations are running smoothly for both the staff and the patients. So I have to do, for example, some bookkeeping. I have to pay some invoices. I have to respond to emails from the other healthcare providers that we work closely with. So I do mostly work in the background to make sure that everything is well planned and organized for the staff and the patients. But sometimes I have to help as well and have to do some hands-on work at the clinic in situations, for example, if we were short-staffed, So sometimes people get sick and they can't come to work that day, or sometimes they have to also maybe go on a vacation with their own families. Or sometimes we're so busy that even though we're well staffed, we still need more staff to make sure that the patients get the best care possible. So I jump in and I help on the front lines and do some hands-on work as well.
Cool.
Does that make sense?
Yeah, makes a lot of sense.
Perfect.
Question 4. What are some of the most important things you use at work to keep everything organized and make sure patients are taken care of?
You will never see me walk around without my notebook and pen. I'm always writing everything down because when you're responsible for the operations of a business, there are so many different loose ends and so many different things that come up and pop up. So I'm always writing everything down to make sure nothing is missed, nothing is falling between the cracks. Then after I have everything written down, I make sure that I prioritize my workload. So I tackle the most important things or the most urgent things first, and that way everything just runs more smoothly. I also create a lot of trackers for both myself and my staff. I create a lot of checklists, some daily checklists of the most important things to do. Sometimes they're weekly checklists of the most important things to do, and that helps, again, make sure that nothing gets missed and everything is always taken care of in a timely manner. So organization. That's really the secret sauce.
The secrets.
That's right.
Question 5. What is one really tricky situation you've had to handle at the clinic, and how do you solve it?
Oh, well, I think the trickiest situation that always happens at the clinic is that being a healthcare provider, sometimes you deliver really good and happy news, and sometimes you deliver news that are not the best. Some delays, some things that didn't work out, we may need to change the treatment plan. So the trickiest situations are usually, for me, they involve having to deliver unhappy news or news that is not what the other person was expecting. Sometimes the journey to any kind of treatment involves some ups and some downs. So how do you solve it? You have to make sure that your patients are just really well supported. They're well heard. You have to make sure that there's always a safe space for them to react however they need to react to absorb this new information. You just have to make sure that you are supporting your patient in any way possible. You are making them feel heard. You are providing more information if they need more information, whatever that they need to recover from the bad news. So that's usually the tricky situation that you run into when you are in the setting of a healthcare clinic.
Wow. How do you make sure patients feel calm, safe, and cared for when they come into the clinic?
That's actually a very important aspect of any clinic, to make sure that your patients are safe and cared for in the best ways possible. I think that knowledge is power. I think that when the patients are always well informed every step of the way throughout their journey or throughout their treatment cycle, that's how you make them feel calm and safe and cared for. So you provide them with all the information they need. Sometimes that means I have to create some information packages or some brochures or some links to some websites that gives them more information. Whatever that it takes to deliver the most information in the simplest way possible to make it well understood. So I think that being well informed and providing that kind of environment for the patients is what makes them feel the safest and most supported.
Okay. Question 7. What's your favorite part of working in a clinic that helps people on such an important journey?
Ooh, my favorite part. I have a lot of favorite parts, but I think it all comes down to having such a direct impact in a positive way on someone else's life. When I'm helping someone or when I'm helping a couple, kind of making their dream come true of starting a family and having a baby of their own, that's the most rewarding part for me, especially when they come back 9 months later and they bring me the baby picture and they thank me for my help to help them create this new family that they now have. That's my favorite part and the most rewarding part for me.
Question 8. What's something really important your job has taught you that you couldn't learn in school?
Ooh, that's a very good question. Because no matter how much information and knowledge you can learn at school, there's always more things to learn in day-to-day life. I think the number one thing that my job taught me that school didn't really teach me is how to interact with people. People are very different, and I learned that you have to approach people based on who they are and what the situation is like. I learned that you can't really generalize. You can't really approach everything, every situation, and every person the same way. You kind of have to read and react based on who you're talking to, based on what the situation is. So don't assume anything about anyone and don't generalize anything about anyone. Treat every person for who they are and their individual selves.
Question 9. What advice would you give to kids listening right now who want to lead a business or run a medical office one day?
My advice is to think of leadership a little differently than what we maybe normally approach it as. So when I think of myself leading my team, I don't think of myself that I'm in charge of my team. I think of myself like I'm there to serve them. So being a leader for me means that you have to serve who you're leading. You have to make sure that they have everything they need to perform the tasks that you're asking them to perform in the best way possible. So you have to provide the information, the training, the support that they need in order to do their job well. Think of it this way. Think of leadership like a tree. No matter how big a tree can get, no matter how many branches it may have, at the end of the day, what holds a tree together is not the tip of it, but
the roots.
Exactly. So for me, leadership means that I am the root of that tree. I have to make sure that everyone is served properly, everyone is supported properly. It's more like I'm supporting them than I am just in charge of them or just bossing them around. Does that make sense? So that would be my advice to the kids that maybe want to lead any kind of business or a medical office one day. Think of leadership differently.
Like a tree and its roots.
Exactly.
Question 10. If other kids wanted to work in a clinic like this one day, what's one thing they should start learning or practicing right now?
Ooh, that's a very nice question. I think they should start learning about themselves, because in healthcare, in any kind of medical clinic, specialty clinic, there are so many different pathways and there are so many different roles to play within a healthcare setting. You could be the doctor, or maybe you could be the nurse. Maybe you could be an ultrasound technician or a phlebotomist. There are so many different roles to play in the setting of a medical clinic. So you have to learn about who you are, what you're good at, what do you enjoy the most, how would you like to help people by using what you're good at. So the more you know about yourself, and maybe the more you know about all the different careers within healthcare, that way you can kind of match what your skills are and what you enjoy the most and what you're naturally good at with the role that fits best. So learn about yourself, do well in school, learn as much as possible about who you are, and that way you can choose the best role that fits you the best.
That's all the questions.
Oh, okay. Well, that was very fun. Thank you.
Thank you so much, Abeer, for sharing your time and your story with us today. Now it's time for the official Pathfinder career rating.
Ooh.
I rate every career across 3 categories. Impact rating. How much does this career help people make a difference in the community? I give it a 5 out of 5 gold star rating.
Oh, wow, thank you. And why would you give it 5 stars?
Well, it's because it's helping the community and it's creating new people.
Into the community.
Yeah.
That's right.
Preparation level. How much training, schooling, or experience do you need for this career? I give it a 5 out of 5 gold star rating because, like you said, it needs lots of training.
Yes, it needs some education, some hands-on training. It needs a little bit of everything. You're right.
Yeah.
Yes.
The Audrey Fit. How much I personally enjoy this career. I give it a 4.9 gold star rating.
Okay. Can you elaborate more on that?
Well, my highlight in this is delivering the good news.
Yes.
Seeing the smile on the person's face.
That's right. You're very right about that.
A quick shout out to my sister's podcast, Olivia's Book Nook, where she shares book reviews and recommendations. Go check it out. And finally, thank you to all the kids and families listening. Keep exploring, keep asking questions, and keep building your own path. See you next time.